So Jane, we know that it's quite common for people to feel low in mood after a stroke. So it's important that we know whether or not you are, because if you are, then we can look at getting you some treatment. I'd like to ask you some questions about this, if that's okay with you.
Mm-hmm. Yes.
Are you basically satisfied with your life?
No.
Have you dropped many of your activities and interests?
Yes.
Do you feel that your life is empty?
Yes.
Do you often get bored?
Yes.
Are you in good spirits most of the time?
No.
Are you afraid that something bad is going to happen to you?
No.
Do you feel happy most of the time?
No.
Do you often feel helpless?
Yes.
Do you prefer to stay at home rather than going out and doing new things?
No.
Do you feel that you have more problems with memory than most?
No.
Do you think it is wonderful to be alive right now?
No.
Do you feel pretty worthless the way you are?
Maybe yes.
You may be asking yourself whether or not it was a good idea to even go down this path about asking about her mood. After all, you're not a mental health professional and you might not feel comfortable with how to respond to some of these questions. But let me reassure you, you are doing the right thing. Depression after stroke is seriously underreported and undertreated, and the golden rule is that if you don't ask, you won't get told. Do you feel full of energy?
No.
Do you feel that your situation is hopeless?
Yes.
Do you think that most people are better off than you are?
Yes.
Jane, I'm a bit concerned. From the quiz, you've told me that you're feeling worthless and hopeless and that life isn't so wonderful at the moment. Sometimes when people feel all these things, they also feel that life isn't worth living at the time. Have you felt at all recently that life isn't worth living, or that you've been thinking about suicide?
No. No. Not that.
People often worry that asking someone about suicide will actually put the idea into their head. That's not actually true. There's no evidence to show that, and generally people are actually quite relieved to be talking about it if you do ask them about it. If someone does say that they are thinking about suicide, there's more information after the video on what to do at that stage. Jane, as I said before, I am quite worried about you. The things that you're reporting to me, the hopelessness, the worthlessness, the not enjoying your life, those could all be symptoms of depression. The good news is that depression, while it's very common and it's also very treatable. We would do things like talking to your GP, doing talking type therapies. There's a lot of different treatments that we can use to look at treating you if you are depressed. But it's not my area of expertise, so I would like to bring someone else involved in your care.
Yes.
Would that be okay?
Yes.
So would it be okay if I rang up your GP and let her know that you were feeling pretty low, and maybe get her to talk to you about your mood and look at some treatment options?
Yes. Would be good.
Yeah.
Yes.
There are a lot of things that rehabilitation professionals can do to help with someone who's feeling low in mood. Exercise is a big thing. There's a lot of evidence to show that exercise can help improve people's moods. Goal setting and helping someone to engage in activities that are important and meaningful to them is also very important. And finally, having a good supportive relationship with the patient is probably the most important thing that you can do. What I mean by a good supportive relationship is doing things like active listening, so allowing the patient time to talk and actually listening to them, offering them some realistic reassurance and also instilling hope, and just a common sense approach. Just be yourself and actually be there with the patient.